Marois P has brought out a study looking at hyperbaric oxygen therapy versus conventional therapy in cerebral palsy, and they've labeled this article, "Can it end the controversy?" What they've done different from every other study is they've used the gross motor functional measure ratio change to see if things have actually made a difference. They're published. There's a difference. It favors hyperbaric oxygen therapy. So what did these guys do different from everybody else? Essentially, all the prior studies use some kind of surrogate marker that doesn't effectively quantify the amount of motor change in these patients. We know that GMFCS will never change, but GMM should change. Now, no one has done that until now. And with this study, basically, they're shown there's 44 studies included, 4 studies looking at just hyperbaric and cerebral palsy. And in total, what they're finding is hyperbaric oxygen therapy is a better treatment than conventional therapy. Better than any other recognized treatment in cerebral palsy, hyperbaric is the way to go. Now, they're comparing for regular physical therapy, 2 hours per week. They're looking at very intensive physical therapy. They're looking at stem cells, like rhizotomy, hippotherapy, Botox. And here's the thing. I can't really go against what they say, but I can't fully support it. Hyperbaric oxygen will improve perfusion in the brain. It will make the blood vessels and the brain tissue all connect to itself. It makes that much more available for these kids to improve. The thing is, if they're not trained to behave like normal kids, they will still be patients, they'll still be dependent. And the home exercise program that we teach our parents to do with these kids often has a big role in this. So, yeah, hyperbaric is good. There's no doubt about it. We've known all this time. There's plenty of papers trying to say otherwise, but this shows that it really does work. If you use the right measures, you can see the right outcome. But it's also what the parents do with the kid. And most parents kind of drop a kid at a therapy center. They don't know what's actually happening, and something happens, but it may not actually be a dysfunction. So this is a really good paper.